Let's think a little bit about tooth extraction. It's probably one of the most common procedures worldwide in dentistry. And how do we do it? How do we perform it as dentists? Should we perform a conventional tooth extraction using forceps? That's my question here today. Because when we do that, we should know that we face tissue collapse, no buccal plate, no bundle bone. Okay, so we are facing and we are looking at irreversible phenotype changes every time we do a conventional, let's say, tooth extraction. So my proposal here is that whenever for some reason a tooth is to be extracted, we should say no. Please say no to conventional tooth extraction. What I want you to think, I want you to think reverse path. No extraction, selective grind and destroy. And why? Why is that? Because you should do it. You should really do it in every tooth extraction because this is going to be the new tooth extraction. And let me just walk you through a super simple case of mine. Okay, this patient of mine. He's gonna go for a partial denture, so he's gonna be wearing a denture. We have two lost teeth in the front. Why should I hold a forceps and extract these teeth? Because once I do it, remember, tissue collapse, no buccal plate, no bundle bone. So when I extract these teeth, if I do it conventional, I will provoke bone collapse in tissues under a denture. So what I'm proposing here is no incisions, no flaps, no grafts, no collapse. Let's see how I do it. I go through the canal. You can use multiple burrs. I'm using here a straight hand piece, as you can see, and I go inside the tooth. I go the entire length of the root, okay? And I make sure I'll go well beyond the apex of the roots. So that's what I'm doing here. And then I will enlarge the canal. You can do it with a straight hand piece. You gotta have burrs that are adequate to do this. Okay, in this case, diamond burrs, that's what I would recommend. But also you can use laminate burrs, as you'll see later. So I'm enlarging everything. I'm going until, as much as I can, until the apex of the roots. Okay, I'm enlarging everything because I'm destroying the roots. I'm destroying the roots inside out. Okay. So it's really, really very easy. With the laminate burr, I have a thin plate now, a thin buccal plate, the entrance, let us say, and now I'm just destroying also that part, the most coronal part of the root, okay? Most coronal part of the root has been destroyed in one of the roots and in the other root. When you use laminate, be sure that you're holding the straight hand piece really good, because it's sometimes it can be tricky. Also, you can use root membrane kit, okay, to do this, but this is faster if you initiate this part. The root membrane kit, as you'll see, now I'm using the burr from the root membrane kit to do refinement. Okay, I'm refining the destruction, the selective destruction that I've done to my teeth. This is an anticoagulant therapy. I'm putting a collagen sponge, a spongostan or something, just to contain the hemorrhage. And so I have, I would say, selectively destroyed two roots, two teeth. I didn't pull them out. I didn't do any conventional extraction. You can see the CBCT here before and after, okay? And by leaving that shield, by having done reverse PET in such a beautiful way, so I didn't have to extract anything. it's much easier than you cut the root in half and pull it out and pull the half that you want out. Because when you do that, for instance, in this case, on a conical root, you have the risk of bringing everything along. So that's why I'm advocating selective grind and destroy. Selective grind and destroy. That's the new tooth extraction. Reverse PET, the new tooth extraction. You can have a much closer look of what happened here, and you can see that by this means we were able to preserve that periodontal ligament. We were able to preserve the buccal plate, the bundle bone surrounding that periodontal ligament. So no tooth extraction. If we don't extract teeth on a conventional way, there will be no phenotype changes. That's what we want. So I heard you. In your next tooth extraction, and I would say in almost every tooth extraction, reverse PET. You reverse PET. Try to do it, because this is going to be the new tooth extraction. And my article, just a fresh article, it's finally been published after being accepted 1 year ago in International Journal of Future Dentistry. And this is with an implant case, okay, this article. But you can do reverse PET because it's the new tooth extraction. Think reverse, just make sure you think bio. So your next extraction might be reverse PET.